to introduce you to our latest cohort and let you hear from our corporate partners. Sorry, I have Siri talking to me. And so this has been an extraordinary year, clearly. And like everybody, we've had to pivot a bit. We held this program virtually and obviously this event today virtually, but we've got a great afternoon planned for you. And hopefully this fall, we'll be back together in person. So the powerful idea behind Engage is to bring together startups and the Southeast leading corporations to create a program to drive corporate innovation and accelerate the startups' go-to-market efforts and to help support Atlanta and the Southeast as a leading tech hub. We could not do this without our corporate partners: Chick-fil-A, Cox Enterprises, Delta Airlines, Georgia Pacific, Georgia Power, Goldman Sachs, Home Depot, Inspire Brands, Intercontinental Exchange, Invesco, Invest Georgia, and UPS. Thank you for your support and dedication. You'll hear from some of them today, and Daley will also introduce you to our newest corporate partner. I also want to give a special shout out to our partner, Georgia Tech, and the Engage team. This go-to-market accelerator program and our cross-corporate innovation activities are the cornerstone of Engage, and Georgia Tech is the brain trust behind that and the administrator of those programs. So thank you, Georgia Tech. So this is and this is really working. Thanks to these partners, we've invested in over 50 startups and have gone through this program, accelerating their growth, attracting venture investment, and creating thousands of jobs. And between those companies and our corporate partners, we've had 85 contracts to date. Incredible. So we invited you to join us here today because you can help these startups, whether it's capital, connections, or insights. Our ask for you is to look for ways to join us in helping accelerate these startups' success and go-to-market efforts. So with that, we're really excited to introduce you to our cohort 7 companies and have them share their progress with you. So I'm going to hand it over to Engage Managing Director Daley Ervin. Thanks again for joining today. Daley, all yours.
Thank you, Blake. So earlier this year, we announced that Inspire Brands, the nation's second largest restaurant group, joined the Engage platform. And today I'm thrilled to announce our newest corporate partner, Wellstar Health System. So Wellstar is Georgia's largest integrated health system, serving over 1.5 million patients a year and has over 20,000 team members across the state. And Wellstar, really helps us fill in the healthcare vertical that we were missing across the Engage platform and this critical industry perspective for our Engage corporate partners. And through this partnership, Wellstar is going to benefit from the expertise of other industry-leading corporations that are already a part of Engage, as well as leveraging the research capabilities coming out of Georgia Tech and the startup ecosystem here in Atlanta. And to talk more about that vision and their reason for behind investing in Engage, I'd like to welcome to the stage Dr. Hank Capps, who will be joining Engage's advisory board. So Dr. Capps is the Executive Vice President and Chief Information and Digital Officer at Wellstar Health System. And he leads their tech and innovation organizations and is helping Wellstar shape the future of healthcare. So Dr. Hank Capps, thank you so much for joining us.
Hey, Daley, thank you. I'm excited to be here and excited to be a part of the announcement of our partnership and joining this incredible organization and other corporate partners and the startup community here.
Awesome. And Hank, it's been a challenging year for everyone. It's also been a very, very challenging year for healthcare in general. How did you navigate these past 16 months? And I guess more importantly, what was the forcing function that COVID provided to help Wellstar turn this crisis really into a catalyst for innovation?
Yeah, that's a phenomenal thought and question to start on. If you go back in time to 2 years ago, we were all sitting around thinking about what the future would look like and how technology was going to intersect with the future as we continued to deliver care in new and different ways. And we were planning for 5 years out, 10 years out. I mean, the thought process is that's when, the critical mass was going to exist for that type of innovation and digital to kind of be in our space. And then, March 12th, 13th, repetitive national and statewide declarations of emergency around the global pandemic. And literally in real time, we watched the world advance before us in the healthcare sense. We had a crisis on the delivery of care side of it and an opportunity in the sense that we now had offices closed, people not wanting to come to facilities, and a remarkable change in demand for care in different mechanisms. And so in real time, people were rolling up their sleeves and figuring out how to deliver care at that moment with the amount of innovation needed to deliver it in a context no one had imagined or had imagined a decade into the future. And so with that as kind of the initial catalyst, we then saw demand from providers, demand from patients, and new care models developing that looked a lot less like hospitals and ambulatory clinics and these discrete walled off kind of entities, and a lot more like an ecosystem of care where people were navigating between their needs and wants in the context of healthcare, and our providers and leaders literally inventing healthcare of the future in real time.
Amazing. Speaking of just kind of like learning from other industries, healthcare is a very, very tough industry. We talked about this before, very insular, tons of complexities. What are some of the biggest challenges facing healthcare today, not just in Wellstar, but in general? And what are you doing to plan on solving those?
Yeah, so when you look in the context of healthcare, you described it very well. It's complex, it's highly regulated, and it's an industry where not a single person wakes up and says, let's go do more healthcare today. By definition, when you're coming to us, you're having a bad day, or you're worried, or you've just gotten bad news, or you have a family member who is in the midst of some sort of crisis. And so when you combine that dynamic of the regulatory environment, all the constraints that we have in place to deliver care at the highest quality and safety, and a mission like we have to care for every single person, to deliver people care, not just not just the typical care. It means that we're solving it in it's like a 5-dimensional puzzle that you're trying to solve. And you saw in the context of the global pandemic, regulations lifted. And so you saw just this rush of innovation happening around digital, around medical licensure, and some of the less exciting kinds of things that really drove care into venues that we would have never really expected. At the same time, you had this consumer environment that was rushing toward healthcare even before the pandemic. But now it's not just rushing toward healthcare, it's the expectation that healthcare is going to rush toward the consumer. So it's almost this kind of dynamic of a post-consumer experience of where now not only do we need to deliver on what a consumer would expect, but we need to meet you where you are. And so it really has reshaped how we're going to solve those problems, because we can't be held back by just the regulatory environment. And we see now the need to innovate in and around in that 5-dimensional puzzle. And then we know that we've got to take healthcare outside of how we've always delivered it, not just in the sense of like we're going to do a video visit or a digital encounter that was necessitated by that moment in time, but that there's a whole new model of care that has to be developed. And it has to be developed literally around the patient rather than the locations that we have typically organized care. And in doing so, we're going to be able to remarkably alter how patients experience it and still deliver on that quality and safety that has to be there every single time.
And then, so today was a big day, not only announcing our partnership, but also you guys announcing your new initiative, Catalyst by Wellstar. Then this is going to be your innovation architecture. Why did you choose this approach, and what is this? What is the systems that make this going to be successful?
Yeah, we are incredibly excited about announcing Catalyst by Wellstar today, and our first partnership with Engage. We're also humbled to come into the marketplace with the thought process that if you design an architecture for change that acknowledges the need to go across both the brick and mortar and the digital architecture, that we can literally design healthcare of the future. And our belief is that, as we continue to build out the different components of Catalyst by Wellstar, that we ultimately have to create a health system that is moving at a rate faster than the pace of change. And that's just something that healthcare's never done. Healthcare has always moved at a glacial speed, built around that quality and safety that has to be there. So in a sense, the innovation architecture has to be different because you've got different constraints within a healthcare environment. But there is a reality that the capabilities that exist in other industries can be harvested and brought into healthcare. And within healthcare, we can literally design the future in the context of those capabilities that are from other industries, and then bring them into the concept of healthcare delivery. And so with Catalyst, we're going to be digging into what consumers and patients really want in a way that is not typical inside the design of healthcare, because we actually think patients should be designing the care, not just people like me. And we're going to create lab environments where we're able to take ideas and run them through to the point of making a difference in real time on the impact of our communities and our patients. And we believe that convening and partnering with people is a part of the future of healthcare. So to your point around insular, I mean, what healthcare has traditionally been is like, we put up walls around us, we're highly regulated, and we're going to do it how we want to do it, built around, around a generation really of healthcare design. So if you're going to move at a pace more rapid than the rate of change, and you're going to make impact in Wellstar, and you're going to make impact in our communities, and you're going to make impact in the globe, it means that you're going to have to invest in different ways around how care is delivered, and you're going to have to partner with different people and with different communities and with different organizations to bring all of that to life. And so with Catalyst by Wellstar, we are excited about disrupting from the inside out. Like, we want to be disrupted by ourselves in the name of making it better for patients, in the name of making it better for our communities. And at the same time, we're going to drive quality and safety as table stakes. You can never give that up. When you walk into one of our facilities, when you're having a bad day, when you interact with one of us by a digital means, while you are out in the world and we want to connect with you and help you be healthier, all of it has to be built around that premise. And then, as we're thinking about the future, there is a reality that the dollars in the healthcare industry are finite. And prior to the global pandemic, there was a ton of discussion around that finite set of dollars versus the GDP, and how the United States had outpaced its spend versus the outcomes that had been being delivered. Not necessarily on the individual patient, but on the global, more population view. And so, we're going to need innovation to be able to maintain a cost structure that allows us to respond to that mission. And so efficiencies and productivity all have to be mixed into that innovation work. And our team members and how we engage with them as they are the caregivers at the moment of time when people need them most is absolutely incredible. And then literally we have the belief that we can make a difference. And that if we assemble the right people to partner with and bring that into focus and with intentionality, with that mission and vision at the heart of all of it, then that difference extends not just to Wellstar, not just to Atlanta, but well beyond.
I think it's a good jumping off point. When we talk about the future of care, we always talked about, just Georgia and this local ecosystem, but you're thinking much, much bigger, really across the country. So, as you're thinking about the future of healthcare, everyone I think is really curious, what does the future of healthcare look like? Not just in the next couple of years, but also, 10 to 15 years down the road as well. And I guess, what are the key constituents and parts that you need others to play?
Absolutely. So if you think about, step back into time for 20 years ago, we had hospitals and we had clinics, and there were patients and there was a care model, and it was all built around the relationship between your doctor and the care provider and you. Over the last 10 years, with the disruption of an electronic health record, which was really spurred on by the ACA and a part of first encouragement and then later mandatory information across all of those venues, we really started seeing the development of a third venue, which is more of a virtual or engaging with people when they're not in the context of clinical care. And you saw consumerism intersect there, and the development of both relationship and information across all of the venues. So you had relationship with your care provider, but now you also had this expectation that your information was known and that you were known from a clinical standpoint, no matter where you were at. And what we were predicting was going to happen was that over time, it would all blend together and it would be built around your health. And it was no longer just sick care, but it was really health care. And so global pandemic, like we talked about before, a lot of those assumptions about what care is going to look like started getting remodeled. And many of the assumptions we believed prior to that essentially have now been altered and altered permanently, not like a rubber band that's going to go back to how it was 18 months ago. So when you picture the future in that context, progressing from clinics and hospitals to this kind of concept of engagement and virtual care, not in the sense of just a video visit, but the true engagement of populations, to now more of this ecosystem, then you start developing a set of new fundamental assumptions about what the future is going to look like. Some of those are, they're going to always be patients and they're going to always be clinicians. So if you have that construct that they're always going to be patients and clinicians, then how do you start designing care around that? Another piece is that we're not going to be building around the locations like we were talking about earlier. We're going to literally be building healthcare around patients, agnostic of the location. And there's going to be this dynamic of that when you build it around the patient, there are going to be these new services that wrap around the patient wherever they're at and help the patient engage into the brick and mortar facilities where care is going to be delivered over time. They're going to be finite. They're going to be finite dollars. They're finite dollars. They're going to be new disruptors into this space that are going to be redividing those finite dollars. So the future of healthcare looks like an ecosystem that's literally built around the patient, which then is expressed in health, sickness, and life all being integrated. It's not going to be this dynamic of digital health, in-person health. It's going to be health as a whole. And so I think what you're going to see in the future is that care happens almost anywhere. It's going to happen in ways driven by technology that we would imagine today more autonomous, in places that we would have never expected to be at in the future from the standpoint of physical brick and mortar locations. You're going to still have to have hospitals and traditional care settings, but they're all going to have to be interconnected. And it's all going to have to be delivered in such a way that care providers, consumers, and patients are literally hand in hand working toward a better environment. So picture a clinic that might look like a drive-through and curbside service. Picture it sitting in the context of retail, wherever you're at, that the care would be there. And it's going to be in the palm of your hand. Increasingly, you're going to have sensors like we all are already walking around with on our phones today that help predict illness rather than just responding to it. And so what the future looks like is an ecosystem that's interconnected, where locations are no longer the organizing factor, where we have the most advanced technology that helps you as a patient interact with your own health information, have more control over how it all works, and then partner with your clinicians to execute on that care. And importantly, almost all of that is going to require the innovation that we're talking about here. It's going to require the partnerships outside of traditional healthcare. It's going to require capabilities that have been planned within non-healthcare environments to be extrapolated to how we deliver them in healthcare environments. And honestly, it's exciting because, we are at an inflection point in this industry, and the people who lean in to outpace the current rate of change are going to be the ones that differentiate and make the biggest differences in their communities.
Perfect. No, this is something we can get super, super excited about. I think this is amazing. Hank, we're energized by this partnership, and I know all the other corporate partners are excited about it as well. So I just wanted to thank you again for helping us kind of think through what the future looks like, and we're excited that you've joined the Engage platform.
Well, we're honored to be here and look forward to partnering with all of you.
Awesome. Thank you so much. Next up, I'm switching over to Nami, the Director of Engage's Enterprise Go-to-Market Program, to introduce the first startups in Cohort 7.
Thank you so much, Daley and Hank.